Hi everybody, my name is Summer Wong. I'm a fourth year medical student from Nova Southeastern University, and this case presentation was done with the dermatology residents at Larkin South Community Hospital in Miami. So today I'm presenting on the unusual presentation of a cutaneous dental sinus mistaken for epidermal inclusion cyst. So an odontogenic cutaneous sinus tract of dental origin, it's also known as OCST. It's a pretty rare condition where there's an abnormal tract between the skin and the oral cavity, which is usually due to chronic inflammation, infection, or trauma. And it usually presents as these small, painful, red papules on the skin surface, and it may or may not discharge a foul-smelling exudate. And these lesions are typically associated with dental infections, irritation, dental disease, and traumatized teeth. So our case is on an 83-year-old male patient who presented to the clinic because he had a 1.5 centimeter by 0.8 centimeter smooth pink nodule underneath his right mandible, as you can see in figure 1. And it was accompanied by a surrounding tissue depression. And so he said that the lesion had been growing over the past 2 months, and it was draining some slightly purulent drainage as well. And so the initial suspicion was an epidermal inclusion cyst. However, because it had an atypical presentation, we did a shave biopsy to rule out skin cancer. The biopsy came back as a cyst, and so the patient underwent a total excision of the lesion. However, he came back 1 month later after the operation, and the lesion came back. This time it was a little smaller. It was a beefy red papule that was 0.5 centimeters by 0.5 centimeters, and it had a central stoma involving the distal half of the previous excision. And we also noted that he had pretty poor dental hygiene as well. So these findings were consistent with the odontogenic cutaneous sinus tract, and so we sent him to an oral maxillofacial surgery department for further evaluation. So the diagnosis of OCSTs, it relies heavily on clinical suspicions because patients don't typically present with any dental problems or dental symptoms. Therefore, these entities can go misdiagnosed and mistreated and mismanaged for years, and the overtreatment of these lesions can lead to skin scarring and potential damage to the facial arteries and the nerves. And the jaw and the chin are the most common locations. 80% of these cases involve the mandibular molars. So to go into the mechanism and the pathogenesis a little bit, these sinus tracts, they slowly traverse the alveolar bone before they eventually erupt onto the skin surface along the path of least resistance, which is dictated by the muscles and the fascia that's surrounding the area. So conventional root canal therapy, tooth extraction, and a total sinus tract excision usually allows for a complete recovery within 3 months. In 3 weeks, with minimal scarring and no evidence of recurrence during the 6-month follow-up, which is pretty good. And oral maxillofacial specialists, they treat these OCSTs, which may involve, like I mentioned before, root canals with or without surgical removal of the sinus tract. And many studies have showed that there have been positive results with just conservative root canal therapy alone, which questions whether or not these surgical excisions are necessary. However, treating these skin lesions, they're generally not recommended unless it's for cosmetic purposes. And of course, we want to do a culture and sensitivity of the purulent exudate to determine the bacteria and the infection so that can be treated appropriately, and also to rule out other infections such as actinomycosis and syphilis. So OCSTs, they represent pretty rare cutaneous manifestations of chronic dental pathology, and these lesions are really diagnostically challenging, and so patients are often subjected to improper treatment, over-treatment for long periods of time. So it's really important to have a high clinical suspicion and an oral maxillofacial evaluation, especially for lesions of the head and neck. Like, that definitely should be in the differential. So we propose that surrounding tissue retraction should heighten the clinical suspicion for OCSTs. So it's important for dermatologists to consider a possible dental etiology in patients with facial and neck lesions.